Hi, my name is Molly. I'm going to be your nurse today.
Okay, nice to meet you.
How are you feeling today?
Doing okay. I'm a little sore. My lower abdomen from my C-section, it's giving me some pain. But other than that, I feel okay.
Okay. I'm going to do a physical assessment on you today. Okay, is that alright?
Yep.
Okay. Before we get started, are there any cultural beliefs that I need to know about?
Yes. Because I just had my child, I'm gonna be expecting a lot of visitors whenever I can
Okay.
have visitors. And it's in our culture, it's common where everybody has to come. It's more of an obligation, and if you don't come, it's sort of rude. And I know that's gonna be a little bit overwhelming. So there's gonna be people in here, and they're gonna be talking loud. But is it okay if it gets too crowded for you to tell them? Because I can't. It would be rude for me to tell them to leave.
Absolutely, that's not a
Okay.
problem.
And I'll just let you know if I'll give you a signal if that comes up.
Okay, I'm just going to put that in your chart over here on the computer.
Okay.
Now, we're going to have to look at your incision and your catheter sites to make sure there's no infection or drainage. Is it okay that a male nurse comes in to do that?
No, I'm uncomfortable with that just because I'm a female, and I would prefer if my nurse or my doctor was female, whoever was looking.
Okay, that's fine. That's not a problem.
Can you make a note of that, please?
Absolutely. Now, is this your first child?
Yes.
Okay.
Yes, but I know I've been to the visiting when other people have given birth, so I just know what to expect.
Okay. And do you use birth control?
No, it's culturally that's against, but if I do need to be educated on that for for next pregnancies, I would just like to speak with a female doctor about that.
Okay. And for your baby, would you like any genetic testing done, any blood tests, or any?
Well, my child is my husband's child, but you mean like blood tests and
blood
things
tests, yes, to check for any genetic defects or anything of that sort.
like? No, I don't have any concerns about that.
Okay, that's fine. And do you need a religious figure or a pastor or anything to come in and speak with you?
No, I personally don't. Most people do. I just don't feel like that's necessary. But I did bring a medallion. That's just more of a protective eye over my child. When people come, when visitors come, a lot of them might be envious. That's just something culturally that we feel on the inside. I don't know if that's actually true or not, but it just makes me feel better to have it, just in preparation, if that's okay.
Okay, that's fine.
Okay, thank you.
Do you have any concerns about your medications at this time?
Actually, yes. With my pain, I prefer not to take the prednisone if I don't have to. I'd like to just take Motrin if that's okay. I don't like the way it makes me feel, and I think it's a little bit too much. I'd like to talk to the doctor about that.
Okay. Okay. I will let your doctor know, and she will come in shortly to talk to you about your medications.
Thank you. Just make sure it's female.
It will be a female.
Thank you very much.
You're welcome.